have a fantastic panelist that we would like to introduce you to. Our first panelist is Dr. Jenny Bush. She is a pediatrician director and COVID director for Cherry Street Health. Dr. Jenny Bush graduated medical school from the MSU College of Human Medicine, completed pediatrics residency at DeVos Children's Hospital, and has worked as a primary care pediatrician at Cherry Health for 15 years. She is a director of the pediatrics program there and also the COVID response coordinator for the organization. So welcome, Dr. Bush.
Thank you, glad to be here.
Thank you. Our next panelist is Dr. Hollingsworth. Dr. Andre Hollingsworth is a pediatric and internal medicine primary care physician and hospitalist who has been working at Mercy Health Physician Partners for 6 years. He currently serves as one of the faculty members of the internal medicine residency program at Mercy Health St. Mary's, and also serves as a clinical assistant professor in the Department of Medicine at Michigan State University. Additionally, Dr. Hollingsworth serves as the medical director for Baxter Holistic Health Clinic. In his free time, Dr. Hollingsworth loves to travel internationally and try different cuisines, play basketball, and go bowling. So thank you for joining us, Dr. Hollingsworth.
For having me.
And now we want Mr. Brian Hartle to introduce himself.
Hello, everybody. My name is Brian Hartle. I work as an epidemiologist at the Kent County Health Department. I've been here for about 18 years now. And the last couple of years, I've been working on COVID-19 response, as well as getting the vaccination out to our community, along with Dr. Bush and several other of our community partners. I went to school at U of M, so I've got a Buckeye and Spartans around me. So I think you'd probably just listen to me, and you'll get all the information that you need. But appreciate the opportunity to talk to you all tonight.
And Mr. Ranga, he is a nurse practitioner for geriatrics and the owner for Agner Health Solutions. Mr. Ranga's specialty is family practice. He has been in the nursing field for 28 years. He was a registered nurse for 16 years before becoming a nurse practitioner. He's been both a RN on the floor and a director of nursing. Mr. Ranga has experience with acute care, medical surgical nursing, and critical care. His nurse practitioner experience is primary in acute, long-term, and palliative care. Mr. Ranga grew up in India and moved to the US in 1995. He and his wife now live in Okemos and enjoy frequent visits from their daughter. Mr. Ranga, thank you for coming.
Thank you very much. I appreciate having me on.
So we're going to go right into some questions. I'm going to share a few slides with everyone. So if you can just kind of walk me through, Miss Katie.
Yeah, sure. You kind of bring your cursor down to the toward the bottom of your screen. There's like a green button that gives you the option to share screen. So click on that. It'll pull up some of the windows that are on your computer. Yeah, you got it.
Thank you. We're going to start from the beginning here. I'm hoping everyone is able to see my screen okay.
Yeah, we can.
So go ahead, Miss Katie.
Oh, I was just going to confirm we all see your screen. Looks good.
Thank you. All right. So our first question is, why is it important to have any child vaccinated? So we're going to start with Dr. Bush.
Okay. There are so many different answers to this question, so I feel like it's a good one for a panel because I'll throw out an answer, and I think everyone else can probably come up with a different one instead of just saying same.
This like meeting is being recorded.
I think probably for me, one of the most important reasons is to keep our kids safe. There's a public perception that COVID isn't serious in kids. And for a lot of kids, it's not, and that's wonderful. But we just don't know which kids it is going to be serious for. In our practice, we've had one teenager hospitalized for very many months. I'm very afraid she was going to lose her life. And many months later, she's recovered, but she's still struggling, still not walking, still having difficulty talking. It took a very big impact on her. We've We've lost an infant baby to COVID. So even though they're rare stories, and is it likely to happen to your child? No, it's still possible. And I, as a parent, wouldn't want to live with that guilt of, I could have done something to prevent it. I mean, there's so many horrible things that can happen to our children that we can't prevent. But I feel like anything we can prevent from happening bad to them, we should do our best to do that.
Mr. Bryan, if you don't mind answering the question from the health department perspective.
Yeah, I think I'll take more of a community-wide approach. As Dr. Bush mentioned, children aren't at high risk for serious complications from COVID-19, but there are in environments like childcare facilities, schools, where there's a high risk for transmission, and those kids have a likelihood to bring the infection home to their family members, to other relatives outside the home, to other people in the community. So I think beyond the individual perspective of protecting the health of the kids, I think we have to think about how we can protect the health of our community as a whole. To get these kids vaccinated, they're going to be at less risk for infection, and then at less risk to transmit that infection to other people who may be at more serious risk of consequences.
Thank you. Mr. Ranga, from the nursing home standpoint, why is it important for your population, but also children to be vaccinated related to your population?
Thank you. The most important thing with the COVID, from the nursing home perspective, this elderly population is so isolated from all the social events, especially family members and grandkids and other stuff. And that would improve the quality of life and gives a purpose for the families to look forward for a weekend or a holiday. That is so important for them. And if the kids are vaccinated, and the nursing home population is so highly vulnerable and immunologically compromised, and the kids, even though they may not have a severe infection, they could carry and transmit to this vulnerable population. And by immunizing the children, by getting them to visit frequently, prevents the transmission, number one. Number two, improve the quality of life for the elderly, gives them a purpose or time to look forward. And most important, this is something that we could do and prevent the transmission. It is a preventable thing for most part, and that is the right thing to do. If we could prevent from suffering, prevent from contracting, prevent from transmitting, that's the best thing to do for the healthcare industry.
Thank you. Dr. Hollingsworth.
Yeah, I just want to echo pretty much what everyone else has, said. I mean, I think the most important thing is that, no one ever wants to see anyone suffer, let alone, a child, an adult, anyone, from that perspective. And the best thing that we can do, and the number one thing that we can do to help, decrease the transmission and spread of this particular virus is really to get vaccinated. And anyone that, is eligible to do that, that's what we need to do. And I think, that is the best and available option to us, aside from, doing all the other things that are, been preached since this virus first started going out in terms of social distancing, hand washing, mask wearing. All these things are important, but ideally at the end of the day, the best way we can protect each other and stop the spread of this is to get vaccinated.
Thank you. Our next question is, what age is my child eligible to be vaccinated, and will children under that age be able to be vaccinated in the near future? So I'm going to start with Dr. Bush again.
So right now, 5 and up can get vaccinated. In the future, the 2 to 5 group already got submitted to the FDA, and the FDA turned it down, which for everyone who feels like the FDA is just approving everything, that's good evidence that that's not true. They do put a lot of thought into, is it safe and is it effective? And in this case, they found, yes, very, very safe, but it just was not effective enough in the studies that were ran so far. So they told Pfizer, go back and study it some more, try a 3rd dose, see if that makes a difference. And they never release all of their statistics until they're ready to submit to the FDA. So I haven't seen actual numbers, but I've heard a rumor that the numbers on the 3 doses are looking really great, and they're expecting to submit that sometime in the next few months. So hopefully soon that will get submitted and approved, and then I'm hoping within a few months, but we just never know with this stuff. I think if you had asked me that question in November, I would have told you by January. So sometimes we just have to wait and see what happens.
Absolutely. So we're going to move on to our next question is there a population that should not be vaccinated? So if I can start with Dr. Hollingsworth, that would be great.
Yeah, so as Dr. Bush kind of alluded to at the present time, for our youngest, 5 and under, I should say, I guess ages 4 and below, we can't really vaccinate them appropriately kind of at this time, but hopefully in the near future, we'll be able to have the ability to do that. And unfortunately, we're not able to do that at this time. But aside from our young ones, additionally, some of our other populations that we're not really able to vaccinate quite as well, or those that are sometimes those are severely immunocompromised that may have side effects from the particular vaccines. Also, essentially, well, that's kind of the biggest, I guess I said, group that we'd have to watch out for, are those that are just kind of severely immunocompromised and don't have the ability to necessarily get the vaccine or have had side effects from previous vaccines. So we have to watch out for those. And unfortunately, once again, comes to everybody else's responsibility in trying to, get each other vaccinated so that we can protect those that are most vulnerable.
Thank you. And just wanting to piggyback with that, Mr. Ranga, can you share, is there a population in the elderly population that would not be able to be vaccinated that you're seeing?
I haven't come across any contraindication for a vaccine so far, and I have not seen anybody who could not take the vaccine, except the families have decided not to do the vaccination. But otherwise, I have not come across anything.
Thank you. Mr. Bryan, do you have anything to add from a Kent County standpoint?
No, not really. I would just say, just stressing the fact that those who have had a serious allergic reaction to any of the vaccine components previously, those people should not be vaccinated with these vaccines. But other than that, I'd say most people, should get it.
Thank you. So we did have a question earlier today about what was in the actual vaccinations, and if we can kind of dive into that a little bit deeper, I'm going to just start with Mr. Bryan from Kent County. If you can kind of help what's in the vaccinations and how it affects people.
Yeah, so the components of the vaccine are very simple. They're different. The Pfizer and Moderna, as it shows on this slide, are mRNA vaccines, whereas the Johnson & Johnson contains the viral vector, which is a little bit different. But the majority of vaccines for the kids, obviously Pfizer contains this mRNA, and really that's just a component that really provides instructions to your cells to create a spike protein that helps your immune system recognize that. And so it's almost like a recipe. It's giving your cells a recipe to create these things so your immune system can strengthen itself. So if you do get exposed to the actual virus, it can properly respond to that and get rid of it from your body. That's the main active ingredient. It also includes some fats, some lipids that helps the mRNA get into the cells. And then it contains some other components like salts and acids and they're just simple salts and sugars as well that really help to stabilize the vaccine. So obviously these go through a freezing process and a holding process, and so some of those components of the vaccine are just there to stabilize it as it's maintained in freezers and refrigerators and things like that in doctors' offices and in clinics. So those are the main components, and now I'll turn it over to the other panelists if they have any question or anything to add.
Dr. Bush?
Sometimes the giant scientific words that we can hardly pronounce can seem so scary, but I would encourage people that are nervous about those to look at labels of a lot of the things that we take in have those big scary words too. The biggest words on this one is polyethylene glycol, or PEG, and that sounds very foreign, but it's Miralax. It's pretty much the same thing that people take for Miralax. I don't think anybody's afraid of Miralax. Even if you take too much of it, it doesn't hurt you too bad. So So yeah, pretty safe stuff. And then some really basic buffers, because most injectable medications are very, very acidic, and they would sting like crazy if we were to inject them into people without a buffer. So a buffer is just something to bring the acidity level down to make it feel okay going into your arm. And that would be in almost any injectable medicine would have some kind of buffer in it too.
Dr. Hollingsworth, do you have anything to add?
No, I think they pretty much said it all there. Really nothing to add to that.
Mr. Ranga, anything to add?
I don't, they have pretty much covered everything, and I'm not that knowledgeable about all the details about components of the vaccine. But what I would tell people is, it is not what they see on the Facebook or on the social media. Some of the things that are extreme, and also they do get confused about the DNA and the RNA. I would say RNA is not the DNA. It is not the same. It is not genetically modified for the patient. It would not affect them in the long term. So the misunderstanding and the misrepresentation of the vaccine in some of the social media platforms are a little bit extreme, and it is not actually what they read is true.
Professor Moody, do you have anything to add?
No, basically, I'm in agreement with what's already been said. And the main thing, again, a lot of times we don't know what's in a lot of these medications and things that we're taking, but a lot of it is something that we have had before. And the main thing is always check with your provider.
Absolutely. Okay. So our next question is related to our vaccinations in kids and how does it affect our children? So what are the side effects? So Dr. Bush, if you can lead this conversation.
Sure. Side effects are pretty much the same side effects you're going to see with any vaccine. Any vaccine, its job is to activate our immune system and turn it on and teach it a little bit so that the next time it's confronted with something similar, it knows how to attack quick and destroy. But anytime our immune system's turned on, that can give us some fever, some chills, body aches, obviously a little pain in the arm, although I've got to say Pfizer has to be the least painful vaccine that's ever been invented. I barely felt mine when it went in, but everybody's pain tolerance is different. Sometimes maybe a little headache, little stomach ache. This is all just a sign that your immune system's working hard. We did find in studies that the youngest kids have the least side effects. So whereas the teenagers and adults, depending on the age range, anywhere from 15 to 20%. Does that sound about right, Brian? We're getting fever and chills, side effects that were bad enough to make you miss a day of work, about 10%. For the little kids, it was more like 7% of people were getting side effects. So most of my patients that have had the shot haven't reported back any bad side effects to me, whereas I feel like most adults that I know, half of them want to tell me a story of how sick they were the day after their shot. So pretty common to have some side effects for the adult population, not so much for the little kids.
Dr. Hollingsworth, do you have anything to add?
Yeah, I would just mirror what Dr. Bush said. Surprisingly, I would say I haven't had a lot of issues with my kids having any side effects or issues from the shots. But the adults, it's kind of funny. I have a lot more complaints of those things, such as pain, kind of fatigue, and just kind of feeling tired. Whereas my kids just seem to bounce back extra quick. But overall, yeah, I'm not really seeing a lot of side effects with the kids with the vaccination.
Mr. Ranga, for the elderly population, what are you seeing for side effects?
For most part, elderly population is the same on the spectrum of adults. Some people have had fever and body aches and a little bit of fatigue, but for most part, most of them have tolerated very well, and some did not even have any pain or any of the symptoms at all from the side effects.
Thank you. Professor Moody, can you kind of speak to how soon we would see a side effect in any person?
Usually, a lot of times we'll have wait after we give injections and the doctors could back this up. But within that 15 minutes is when we see a lot of the immediate side effects.
Mr. Bryan, do you have anything to add to that from Kent County's perspective and what you're seeing?
Yeah, I would say that, the majority of side effects are going to happen within the first 24 hours of that injection. The pain, you're going to probably wake up the next day and have pain in your arm. Any of those flu-like symptoms that Dr. Bush mentioned will happen within 24 hours. And, any side effect or any serious side effect is going to happen within the first 2 weeks of getting the vaccine. So although serious side effects are rare, any side effect should happen within that first 2 weeks, but the majority are within that first 24 hours.
And I would add
Dr.
that
Bush,
that's
I'm
true.
gonna.
Sorry, jumping
Dr.
right
Bush,
in.
Okay, I was just going to ask you and just lead into that serious side effect. And a lot of people have asked the question about myocarditis in boys.
What I was going to say before I answer that question is that even historically through the years, vaccines that have been presented to us that turned out to be bad ideas and had some side effects and had to be pulled from the market, typically that was known within 4 to 6 weeks of release of the vaccine. So people who feel like they want to wait to make sure it's safe have waited long enough. We're not going to find out something new. Historically, we always know within the first few months, once thousands of people have gotten a vaccine, we know what side effects there are. And in this case, it's literally billions of people have gotten the vaccine. But for the myocarditis, I did re-look up some numbers because they're always changing. And the last time I presented, there have been more cases found since then. So the most current data I could find was in the 12 to 15-year-old boy range. Those are the people that we're most worried about, the young teenage boys. 162 cases have been identified per million people. So on a percent wise, that would be 0.0001% chance of a myocarditis. Now, the myocarditis is inflammation of the heart, and that sounds horrible and scary, and it can be when it's caused by a virus. When a virus, that's the main cause of myocarditis in teenagers. When a virus causes it or a bacteria causes it, it can be very life-threatening, very dangerous. The vaccine-induced myocarditis seems to be much more mild. It is bad enough that many of those people did end up having to go to the hospital for a few days, up to a week, but almost all recovered very quickly, and their follow-up heart scans have been showing normal function. There were a few cases that were more serious, and I never really heard a long-term outcome. Brian, I don't know if you ever got any follow-up on the few cases that were ICU for longer, but that was like 1 out of billions that happened to. The chances of getting myocarditis with COVID are also quite high, quite a bit higher of a risk of getting myocarditis in a teenager that has COVID than in a teenager that gets a COVID shot. And I can tell you, my son is exactly in that age range. I've got a 15-year-old boy. I did not hesitate for a second. The day that they said his age group could get vaccinated, I scheduled for the next Saturday, just so that if we had some side effects, it would be a weekend, and got him vaccinated. And I did not fear or lose sleep or worry about if he was going to get myocarditis.
Thank you. Ms. Katie, do we have questions in the chat?
So we do have a question, and it was related to what Dr. Bush was just speaking to. So I don't know, Garcia, if you feel like that addressed everything, but the question was just, what is an extreme side effect that has been linked to the COVID-19 vaccine in children? So I think that Dr. Bush spoke to that with the myocarditis, but if there's a follow-up, you can certainly make note of your question in the chat or unmute yourself, whichever you're more comfortable with. And I just did put one question in there, and this was not vaccine related, but it was just a question. I wondered whether other people were wondering. But I had a question from a parent who wondered how the infant population are tested for COVID. Just think about the nasal swab and how uncomfortable it is. And I was wondering, I'm like, do they do that to the babies? But that's what Dr. Bush confirmed, is that the same nasal swab as we do for adults, which is the full respiratory panel, is what's used to test infants for COVID. So those are the only things. That's all that's happening in the chat right now.
And let me just clarify on that. That's it depends on the provider. So some providers would just order a COVID test, which can be done with a nasal swab, which shouldn't be horribly uncomfortable, Katie. If it was uncomfortable for you, they were probably doing the full NP, which is the very uncomfortable version. But I think more recently, everyone's kind of transitioned over to just a nasal swab, which isn't that bad.
Gotcha.
I like to tell little kids it's not any worse than picking your nose. It's just going in there a little bit. It's okay. But some providers, especially for smaller infants, will run that full respiratory panel, and that one's the deeper NP with the smaller tube. But yes, it's uncomfortable and the babies don't like it.
Thank
Dr.
you.
Mathis, thank you. Dr. Mathis, I saw that you joined us. Thank you for joining our panelist discussion. Can you just speak to side effects with pregnant women or women who are childbearing age?
Yes. Sorry, I'm late. I got in late from the office, but there have been no different side effects that we have seen for pregnant patients getting the vaccination compared to women who are not pregnant. We definitely recommend that all pregnant women obtain the vaccination and be fully vaccinated with a booster, because we know that pregnant women are also considered to be immune compromised and can get really sick from the COVID virus itself. So we've seen that the COVID vaccination dramatically reduces the degree of severity of illness for our pregnant patients in general. And we've seen very sick non-vaccinated patients with the COVID virus itself. As far as side effects, the pregnant patients do not have any different side effects that we've seen compared to non-pregnant women.
Thank you. So our next question that we have is, if someone already has antibodies, even children, do they still need a vaccine? So Dr. Bush, if you can start with the conversation related to that.
I'd give a firm yes to that. There have been so many studies on this, and they really just, for one thing, have not given us very consistent results. There have been a few small studies that have said natural immunity is better than vaccine immunity, and there's been a few that said that's not true. But every study that looked at natural immunity plus vaccine definitely shows that that's better than either of them alone. So you're not going to do any harm giving that person the vaccine, but you're probably going to boost up their immunity, and you might make it a lot stronger. The other thing is there seems to be a big variation from person to person with their own natural immunity. Some people build an awesome, strong immunity when they see a virus. Some people build no immunity at all and seem to get reinfected 2 months later. So it seems a little bit more consistent with antibody levels with the vaccine. You're sure that you're getting a standardized dose, whereas we also think of dose with an infection. You know, you've got a certain number of viral particles that came into your body, and maybe it's that you got a small dose of infection, so you didn't build much of a response. But I firmly think that we're better off to get the vaccine in addition to our natural immunity. Now, I would say if people want to wait 4 to 6 weeks after their infection, because they're pretty well protected in that little window, I would say that's okay. If they wanted to do it as soon as they get out of isolation, which is what's recommended, that's okay too.
Mr. Bryan, do you have anything to add?
No, that was a perfect answer. I have nothing to add to that.
Professor Moody, anything to add? Or Mr. Ranga, Dr. Hollingsworth, anything to add?
Yeah, I'm just going to echo everything that Dr. Bush said and just say, hey, nothing wrong with having super immunity. That's what we call it. You're never going to be wrong having an immunization on top of after having natural immunity from having COVID. Like I said, we know that the response and just your body's own antibodies just stay up way longer when you have both of those combined. So I would highly recommend.
Mr. Ranga, did you have anything to add?
I don't have anything to add. I agree with everything panel has said.
And then our next question is, are we seeing breakthrough cases among children who are vaccinated? And we can also spread this to the adult population as well. If we can start the conversation with Mr. Bryan, that would be great.
Yeah, we are definitely seeing breakthrough infections across the population, especially with this Omicron variant. We're seeing those who have 2 doses, even boosted people, have breakthrough infection. But I think the bottom line is that it's still more likely that you're going to be infected if you don't have a vaccine than if you do. I think the latest data shows you're 4 times more likely to be infected with COVID-19 if you don't have a vaccination. So yeah, the breakthrough happens across the board, and the additional thing is that the vaccine is going to protect you from serious infection. So we definitely see that in the adult population, where those who are unvaccinated are very much more likely to be hospitalized and die from COVID-19. As we don't have as many kids hospitalized, we are seeing evidence of that those who are vaccinated are less likely to be in need of hospitalization. So breakthrough infection happens, but the vaccine, what? But the vaccine definitely protects from serious infection.
Thank you. Dr. Hollingsworth, anything to add to that?
Yeah, I can definitely say we're definitely seeing, breakthrough cases. And that's to be expected as time kind of goes on, even with vaccines, as we all know, they're with the variants that keep popping up here and there, we're likely to see more breakthrough cases. But we're also likely to see, as long as everyone does get vaccinated, to see these side effects, or not side effects, but see the symptoms and things associated with COVID-19. Those the symptoms become milder and milder, and that's what I'm seeing with both kids and adults. Those that have been vaccinated, you may have get a phone call about I may have had a runny nose or some congestion, but the things that we were seeing initially with the initial COVID-19, and even with the Delta variant, a lot of the very things that were getting people in the hospital initially aren't any longer getting people into the hospital because of the vaccinations and because of people are out there getting vaccinated. So we just got to continue encouraging the vaccine, and hopefully as time goes on, we'll be able to
I'll
see
come
this
back
thing
to
come to the end.
if that pot clean. I mean,
Can we mute our lines if we're not talking, please? All right. So I'm sorry, Dr. Hollingsworth. Did you have anything to finish?
Oh no.
Okay.
Oh, that's fine.
Okay, thank you. So then our next question, Ms. Katie, if you can ask this for Dr. Mathis to speak to.
Absolutely, yeah. So this question is about the impact of COVID on unborn babies. So someone's wondering, have babies born from women who have had a serious case of COVID been physically or mentally affected or disabled from the COVID virus?
In terms of babies, I see the babies the most. I don't see their care once they're delivered as much. I hear the short term for the first days, but it's been very interesting. Most of the babies born to the sick COVID infected mothers have been surprisingly healthier than we would even expect. Even when we see heart tone issues during the actual laboring or before delivery time periods, we do see some irregular fetal heart tone tracings for babies prior to right immediately before delivery on the labor and delivery suites. But usually the babies seem to do very, very well. And I think the actual infection rate for a lot of the babies has been negative, at least while they're in the hospital. We'll have to ask one of the pediatricians to tell us what they've seen when the child is a little bit older, days older. But definitely the mothers who have been vaccinated have trended to do better and be less ill themselves, but we've definitely had some very sick COVID positive patients who were not vaccinated. And I know that in the whole city of Grand Rapids, there's been some extremely severely ill women with COVID, especially with the Delta variant, and not vaccinated. So we definitely know that it makes a difference. One of the other big complications we get worried about with pregnancy and COVID is that the COVID virus infection increases a patient's risk of blood clotting. And so we think part of the issue with the heart tones might be, we don't know yet, we'll have data over time, but whether blood clots are affecting the placenta function. So that's one of the big risks with COVID is blood clots, just the actual infection itself. And we put our moms who are pregnant with COVID on a low dose aspirin for 14 days just to keep the blood a little bit thinner to help minimize that risk to the unborn child and to the mother herself.
Thank you. Let's go to Dr. Hollingsworth. Seeing children who are born from mothers who have had COVID-19, are you seeing any long-term effects for children at all?
Yeah, that's a great question. You know, I'm going to knock on some wood, you know, right now as I answer this question, but the infants that I've seen in practice that have been born to moms that have been COVID positive, even ones that have been more severely affected than others, I've not really seen any no long-term issues or complications or problems with the newborns. They've been relatively healthy, normal. You know, it's fairly early for some of these children, and you know, yeah, time will tell if anything as these kids get a little bit older in terms of everything else. But from a developmental standpoint of what I'm seeing in the office, these kids are either, I mean, they're developmentally on track with their other infants their age that haven't been affected or had mothers that have been affected by COVID. So I just hope that continues.
We're going to move on to some more questions because we have some questions in the chat. Ms. Katie, if you can ask the next question, please.
Yeah, absolutely. So this question says, as the virus mutates, does it generally become weakened, get stronger, or does it depend on the virus?
Mr. Bryan, if you don't mind starting the conversation.
Yeah, it really depends on the virus, and it depends on what types of mutations happen. I think we've seen that with COVID-19 throughout this pandemic, as we've seen some of these, you know, variants be less impactful to the population. Like the first D117 was, you know, it changed things, but it didn't have that big of an impact. But then we saw Delta come down the line, and that was extremely severe. You know, we saw really poor outcomes with the Delta variant in our population, and now we're seeing this Omicron, which, you know, has some mutations that cause it to be more transmissible and more highly contagious, but, you know, likely less severe in terms of the infections that it is causing. So, but we never know. We can't predict. I think you hear that a lot, that, you know, as the virus continues to mutate, it does get weak, but it really depends on what type of mutations take place, and we can't hang our hats on the fact that, you know, Omicron is less contagious or more contagious, but less severe, and, you know, that means the next one will be the same. So we have to keep our guard up and make sure that we continue to get vaccinated and protect ourselves from future mutations and protect ourselves against future variants that pop up.
Thank you. Dr. Bush, did you have anything to add to that?
Not much. That was a good explanation. I think the thing I was taught in medical school is that every virus wants to survive. So their goal is to spread fast so that they can continue multiplying and replicating, but not to kill people, because if they're killing everybody, then they're going to lose their hosts, and then they're not going to have the ability to survive anymore. So, I mean, that's a basic philosophy of virology, to want to replicate quick, spread quick, but not kill. And it seems like maybe the Omicron version's kind of falling in line with that theory a little bit, but I agree, we can't pretend to predict everything, because then we just get proven wrong over and over again. So hopefully it'll get weaker, not stronger.
Our next question is, Professor Moody, if you don't mind starting out the conversation, is how do you prepare yourself, especially if you're nervous with being vaccinated?
Basically, in talking with other community members, basically telling them, educating them in regards to what this is all about, and that everyone needs this vaccine, not force it on them or not making them feel that if they don't take it, something's going to happen, but stressing the importance of them taking it.
So it sounds like you cut out Professor Moody. Mr. Ranga, or Professor Moody, you had cut out.
Okay, so basically just making sure that they're aware of their family members, because we do a lot of family gatherings. And so we want to make sure that the younger kids are vaccinated. So when they go to grandmas and grandpas, they don't, in case they're the ones that will get it, they would be protected from that. So mainly just the education of them and being a voice for them and let them know that we're there. If they go get the vaccine, they could come back and talk with us if they have questions.
Thank you. Our next question is in the chat. Ms. Katie, do you mind asking that question, please?
Yeah, absolutely. It says, why should people who are asymptomatic get vaccinated?
Okay. Mr. Ranga, could you start this conversation?
Sure, thank you. So being asymptomatic does not mean you don't transmit, and also it doesn't mean you will never become infected. So the only time that we know that you are asymptomatic is something should happen. Otherwise, none of us would know whether we have infection in the place. So the being asymptomatic, it is a very vague and a very broad brush of painting of thing that we don't need. That does not guarantee the immunity, that does not guarantee the protection from the infection, and it does not guarantee anything in terms of infection. If you are vaccinated, even if you did get infected, the symptoms could be milder, the outcomes could be better, the morbidity and mortality could be much, much better than a non-vaccinated individual. So from that perspective, just alone, that there is no guarantee. Even when you are vaccinated, there is no guarantee you are going to not get infected, but the symptoms are milder, the outcomes are much better. So from that perspective, I think we should get vaccinated.
Dr. Bush, do you have anything to add?
No, I would just say that when you're not having symptoms, I mean, I guess I don't know if you mean you're infected and not having symptoms or just not having symptoms, but that's when we want to get vaccines, because vaccines are to prevent us from getting something in the future. So to wait until you are symptomatic, it's too late then the vaccine's not going to do much for you right then. I would also encourage people not to feel confident that maybe I had COVID last year and I didn't even get symptoms. I handled it fine, so I'm not worried about COVID. My body's strong enough to handle COVID. I don't think that's what we're seeing. I think that it's incredibly hit and miss who's going to be asymptomatic and who's not, and your past performance with COVID doesn't predict your future performance with COVID. So especially with the different strains, and that kind of impacts how strong it is as well.
Ms. Katie, if you can ask the next question, and we'll have this question for Dr. Hollingsworth, please.
Yeah, absolutely. So it says, do you think that going forward we will need to get the virus annually just like other flu viruses? Basically, is COVID here to stay?
That is a great question. As we see, this has been around since 2019, and it hasn't gone anywhere over the past a little over 2 years now. And I don't think it is going anywhere, and I do think likely we're going to wind up with a vaccine schedule that's probably online or in line with the flu, whether that be a yearly vaccination or biannual vaccination. I think the jury's going to still be out on that, especially as I think some of these vaccines from some of the manufacturers, Pfizer, Moderna, get tweaked a little bit. We may get fortunate and may see yearly vaccines, but it may be a little bit more frequent than that. But I do believe COVID is here to stay, and we're just going to have to see how this kind of plays out here over the next few months to years as to whether or not this is going to become an annual, biannual thing. So yeah, just have to wait and see.
Thank you. Our next question, just trying to make sure that. So our next question is about what is VSafe. So Mr. Bryan, do you mind walking us through what VSafe is for our parents?
Sure. Yeah, the CDC has a system in place to track how people are responding to the COVID-19 vaccination. So when you go get your vaccine, you should be provided information about the program. It's pretty easy to sign up. You use your smartphone to sign up into the system. And what it does is basically we'll send you text messages to kind of ask you how you're feeling. So right, shortly after your vaccine, you'll get very frequent text messages, the day after, like, how are you feeling? Do you have any symptoms or any side effects? Do you feel well? Those types of things. And then it'll ask you another, it'll text you again a week later, kind of ask you what your experience has been. And then I just got one, like I don't know, like 6 months after, my last dose or something like that. So it continues to send you messages to ask you how you're feeling. It also will ask you, have you been infected with COVID, since your vaccine? And so really that's just a system in place to track the safety and the efficacy of these vaccines, because clinical trials that we talk about, there's only a limited number of people who are involved in those trials. And this is just another way for the CDC to gather more information from a wider variety of people on how the vaccines are performing and what types of side effects that people are getting. So it's a simple system. It's just basically surveillance, and you'll get a survey via text periodically after you get your vaccine.
Thank you. Professor Moody, who else should you be talking to related to if you have a side effect in addition to the V-Safe?
You really should be letting your primary doctor know what's going on. A lot of times in the community, people that I've talked with that do not have a doctor, I refer them to one of the clinics, either Cherry Health, Metro Health, all the different clinics that are out there available. Let them know that they should be keeping in track with letting someone know what's going on in case they have any kind of side effects or in case they're not sure what's going on. And someone else could follow up with it.
Thank you. Mr. Ranga, in the nursing home setting, how do you keep track of that from a symptom base and making sure that patients are safe?
So we usually we have a log and a assessment protocol that we follow from the time it was administered to the side effects, mild, moderate, and severe. Based on unusual findings, we do contact the health department and also let CDC, the V-Safe is filled out for the patients, and we also let every authorities know unusual outcomes, which has not been a case in many of the nursing homes. We cover about 600 patients in the long-term care, and in the assisted living, much more than 600. So we have been pretty, expected range of clinical symptoms without any major concerning adverse side effects.
Thank you. So we do have a few slides, but Mr. Bryan, if you can kind of walk through, because we had a few questions around the quarantine guidance in the school system, what's recommended from a King County standpoint. And I know that GRPS has made sure that they have additional steps put in place to keep their students safe.
Yeah, so with this change in the CDC's isolation and quarantine guidance a few weeks ago, that caused Kent County to change our guidance for the schools. And so we adapted the CDC's guidance for isolation and quarantine, the shortened isolation periods. So isolation, for anyone who's positive and who's in a school setting, they're required to isolate for 5 days at home from the onset of their symptoms or the test date if they're asymptomatic. And then if their school has a universal mask policy in place, then they can return to school on days 6 through 10 of their isolation period with a mask on. If the school does not have a universal mask policy in place, then the person has to isolate at home for a full 10-day isolation period. Quarantine really depends on your vaccination status, and it's only really based upon household contacts at this point. So household contacts of a confirmed case must quarantine at home for 5 days, or the full isolation period of the positive case in their household, plus an additional 5 days if they're unvaccinated or under-vaccinated, and then if they then they can return to school after that 5-day home quarantine, regardless of whether or not the school has a universal mask policy or not. So that's, like I said, only for those who are under-vaccinated or unvaccinated. Those who meet up-to-date requirements for their vaccine. So that's like 18 or older who've been boosted, under 18 who've received their primary dose of vaccine. Those people do not have to quarantine at home for any time frame. You have to return when they return to school. They do have to wear a mask for the full 10 days after their last contact with the positive case in the household. So that's only for household contacts. So if you read the public health order, non-household contacts, school contacts, those people are not required to quarantine. They're highly recommended to quarantine from school, but not required for that. Contact tracing, someone asked us in the chat about how contact tracing is going in schools. Schools are no longer required to contact trace inside the school. So school contacts, because of the Omicron outbreak and just the massive number of cases that we're seeing, it's just overwhelming to school staff. And so we removed that requirement for them. So school contact tracing is not taking place, or is not required by the county health department for schools to do that. Some schools may be still doing that on their own, but it's not a requirement from the county health department. So it's changed quite a bit, both with the Omicron surge, as well as the new CDC guidance on isolation and quarantine. I know that's a lot of information to spot off here and differences in vaccine status and whatnot, but I hope I didn't confuse you too much.
No, that was very helpful. Thank you. So another question that we had was related to how do I continue to keep my family safe during this time? So we'll start with Dr. Bush at this time.
Vaccinate them. That's definitely the first thing. And then all the stuff that we've talked about for 2 years now. So I'm still a very big proponent of masks. I really think there should be universal mask mandates everywhere. It's not going to happen again, but I think that would be the right thing to do. For me and my family, when we leave our home, we put on a mask. I mean, if we're going to a store, if we're going to a school event, we wear a mask. I try to avoid any areas that are crowded, even like school events. I don't think an indoor basketball game is a great place to be right now. So just trying to be reasonable, balancing that though with the need for some socialization in our lives. So I feel like my kids' close friend group, they're exposed to them every day at school. So I don't care if they keep getting exposed to them at night. I feel like they might as well be considered family members at this point. They're together enough. So if they want to stay with that same friend group and, I don't know what they do, run around and do their teenager stuff, that's fine with me. But just trying to avoid the really big crowds, masking, hand sanitizer when they get home. Just doing their best to try to decrease risks as much as possible.
Dr. Hollingsworth, anything in addition that we need to keep our families safe?
I mean, all the things that Dr. Bush just said, I mean, I just have to echo those. There's not much more to add to that. I mean, we continue to do those things that we started doing when COVID first hit the scene. I think, over time we become not saying that we become a little bit lax with the vaccine, but with the vaccine around, we have to remember that though it provides us protection, it doesn't, you can't get the virus or you can't transmit the virus. So we still have to be aware of those things and really continue to use those precautions that we were using when COVID-19 first hit out. And I think it's just reiterating those things and reminding ourselves that we need to continue to do those things to keep our families and others safe.
Thank you.
Keisha, I'll just say one more thing.
Yes.
I wouldn't forget about other vaccines too. We've gotten so tied up in COVID. Children's vaccines, they're still important. We've seen a big drop off in measles and chickenpox and pertussis and all those vaccines that are still really important for these kids because we've been so tied up in COVID talk. So it's important too to not forget about those other doses of vaccine that we've always had for the kids.
Well, then it leads us to another question quickly is around, can my child have the flu vaccination and the COVID-19 vaccination? So if you can answer that, Dr. Bush, that'd be great.
Yeah. Sorry, I'm going to admit that I got distracted and read the chat while I should have been listening to you, but can you repeat the question for me?
Can my child get a flu vaccination and a COVID-19 vaccination at the same time?
Absolutely. there's a lot of different people have different philosophies on multiple vaccines in one day. I think the fact that you get vaccinated is the most important thing. So if there's a family that's saying, I am not going to give my kid 2 vaccines, I'm happy to schedule them a week apart, and we'll get them both done 2 weeks, a week apart. From the kid's perspective, though, the risk of side effects doesn't really go up very much when we do 2 at the same time. The risk of pain isn't that much different when we do 2 at the same time. But I feel like when we split them up, then that's 2 days that kid had pain from a needle, and that doubles their chance of being afraid of needles and afraid of their next vaccine. So personally, I'm a fan of get it done all at once. Even if you're behind on IMS and you need 5 vaccines in one day, get them all in one day. Have one bad day that kid's upset about being at the doctor's office, and have it be over with, instead of spreading that into 5 different days to be upset.
Okay, we are wrapping up here. I want to just quickly go over the mask guidelines. Mr. Bryan, if you can kind of speak to what CDC talked about with masks.
Yeah, so with the Omicron variant and how contagious it is, CDC's come out with more guidance about using the higher level masks like the N95 respirator or KN95, which are provide greater protection from transmission than does a cloth mask or a disposable mask. So on this slide that Makisha created, it's kind of left to right in terms of the protection that they provide. N95s and KN95s are not as comfortable as a disposable mask or a cloth mask. Right now, cloth masks are really kind of not recommended, because of the Omicron variant and how contagious it is. I've seen some new programs where N95s are available at grocery stores and Meijer and pharmacies and things like that. KN95s, where we have them here at the health department, we have bins in our lobby. So if you want KN95 masks, they're available here at the local health department. But I would just say that any mask that you have is going to be better than no mask. And so if you can't get access to a KN95 or a disposable mask, or whatever mask you have is good enough, or better than no mask. And so I wouldn't worry about it. And it's so important to wear a mask these days, as Dr. Bush mentioned. We're dropping off in terms of our case numbers every day, but we're still close to 1,000 cases every day being reported to us. And so that just shows that there's a lot of virus out there, and masking is critically important.
Okay, so vaccination resources. So if each of you who represent these organizations, Kent County, I know we have places where we are able to get vaccinated there. And Dr. Bush, you have Cherry Street Health. We also have Spectrum Health, has a vaccination clinic. University of Michigan Health also, Mercy Health, and then their local pharmacies as well. GRAAHI does have a place that you're able to get your vaccinations, and that is going to be on Monday, February 7th from 2 to 6 p.m. At the Brown Hutchinson Ministries. So you can be able to register at graahi.org. If you have barriers to get to these locations, please call the 211 number, and that will be able to give you some resources to be able to get to the locations to be vaccinated, because we don't want anyone to be feeling like they can't have access. So, and all our slides came from CDC and the Kent County. So, any last words for our providers? And thank you so much for being a part of the panelist discussion. So, any last words that you want to leave our audience?
One thing I would mention is lately, I feel like I've had a few patients who have felt like it's just a cold and they don't want to get testing done. And I think that really also helps drive the rapid spread through our community. So even if it's just the smallest runny nose, if it's a new little runny nose.
If you're not talking, can you go ahead and mute your line, please? Sorry.
Or a sore throat. It seems like we've been hearing a lot more sore and dry throat as the only symptom of Omicron, more so than the previous variants. So if you've got those, it's really not, it's a little bit hard to find testing, although our testing's slowed down. So Cherry Health has same-day availability this week for testing. Or try to get the rapid home test kits and test at home. I think eventually it would be a good idea once they're more available and easier to get. Everybody should just have a few test kits at home. So you wake up and your throat's a little sore, just do a quick test before you go to school or work and make sure that you're doing okay.
Dr. Hollingsworth, any last words for our community?
Yeah, I'm just gonna say, just you want to remain vigilant and encourage whoever you can that's eligible to be vaccinated to get vaccinated. And I also say we just kind of touched on this really briefly, but if you have the ability or you have the chance to get these testing kits to get a few testing kits for yourself and your families at home. I'll just speak a little bit. I think the government just released a website. I think yesterday, not yesterday, but a few days ago about getting free COVID testing kits at home. So you could check that out. They're free, but they can be hard to find kind of within the city. So just if you can get those and just be able to test it at home if possible, and just stay vigilant.
Mr. Ranga?
So just everything everybody has repeated, and I do encourage seek more information if you are conflicted with the information available about the safety of the vaccine and how important it is. There are a lot of resources available, and Keisha, if you have any family or friends available that need, we could help them as well to educate and make sure that they get the right information so they can make a right decision.
Thank you. Dr. Mathis?
I agree with everyone else's comments for closing, and also just the fact that it just, like has been said throughout the discussion, if there's any question, if you have any concerns or questions for your own personal candidacy for getting the vaccination, ask your own personal doctor too, because if you think you have a certain condition or certain issue that would be a conflict, of course, ask your doctor to see, or your physician assistant or your nurse practitioner, whoever it might be, your nurse, whoever it might be that you typically trust with your healthcare, ask them if you'd be a good candidate for the vaccination if you have any hesitancy, because we do have a lot of information available and information for your particular situation.
Thank you. And Professor Moody, are you still on? Okay. I am putting in the chat a survey. So if you want to complete that survey, you can ask questions in that so we can make sure that we get back to you. And we also want to make sure that we continue to give informative information that's going to help answer your questions. So thank you so much for participating with us. Thank you so much for our panelists for taking the time. I know that you're super busy in healthcare, working with patients through a daily basis. So we appreciate your time being able to answer questions for the community so that they are able to make informed decisions for their family. So thank you.
Thank you all so much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
The recording has stopped.